Hi everyone, my name is Jason Simpson. I'm a third-year doctoral student up at Forest Institute. I'm going to be presenting today on adolescent sleep. The presentation is titled Today's Sleepy Adolescent. And I say today because I'll explain to you a little bit more why I say today and why this generation may be particularly at risk for inadequate sleep and some of the problems that can be associated with that. So we're going to talk about that. I want to just make a quick note of my project sponsor, Dr. Powers. He's a faculty member at Forest Institute. So I want to paint you a quick picture of what we're looking at when we think of a typical adolescent today. And we have a model up there sort of demonstrating something that may or may not happen for a typical adolescent during a typical classroom day at some point in time. Of course, this may be a little bit dramatized. You know, usually there's teachers keeping our kids awake and things like that. But the typical modern day American adolescent, she's going to devote time later and longer to extracurricular evening jobs. There's research that's shown that American high school students are more likely to be employed than similar age students of most other industrialized countries. She is almost assuredly a text machine. 72% of all teens communicate via text messaging. And that was a number from 2010. I'm sure that number continues to increase as the research has shown that it is. 72% I think is probably conservative. It's probably a little bit higher than that nowadays. And with her cell phone in one hand, she's likely holding an energy drink or a latte in the other. An estimated 75 to 98% of youngsters consume at least one caffeinated beverage each and every day. So it's probably near the higher end. I've seen research that the research tends to support the 85 to 90% range. 75% is the lowest that's been shown in recent years. But needless to say, most kids drink caffeine each day. And in addition to, or perhaps due to some of these new age habits, she's also severely and chronically sleep deprived, and that's what we're going to talk about today. If there are any questions to be posed, just please offer those at any time or keep those in mind, and we can discuss those at some point in time. And so we're going to start out with just an informal quiz. Fact or fiction, if you guys want to take a look at that real quick. So when I say fact, it's particularly in psychology, but also in research in general. Fact is not really a term that we go with very often, but what I'm asking is, does research support or not support this statement? So think about these. The first one being, human beings can acquire sleep debt, much like a financial debt that accumulates each time less than optimal sleep is obtained. In fact or fiction, this one is fact. And I say fact, you know, just like I said, the research supports the idea that there's an accumulation of sleep debt, and it's a debt just like financial debt that's not going to go away if you get a few nights of good sleep. It accumulates over the course of the lifespan. Next one, as long as you obtain an adequate amount of sleep at night, it doesn't matter when you fall asleep or when you wake up. So as long as you're getting your 8 hours or the recommended amount of sleep, it doesn't matter when you do it. Is that fact or fiction? This one is fiction. There's actually something called an eveningness type shift where it's related to our circadian rhythms and when we sleep. And if you go to bed later and wake up later, that's, even if you're getting the same amount of sleep as someone who would have fallen asleep earlier and woke up earlier, that type of a sleep pattern is associated with a slew of emotional behavioral problems and things like that, which we'll discuss in more detail a little bit later. Fact or fiction, poor sleep in adolescence is predictive of mood and anxiety disorders in adulthood. This one is fact in the sense that there's a lot of research showing that inadequate sleep, regular inadequate sleep in adolescence can predict the development of mood disorders, anxiety disorders in adulthood. So that's something, again, we'll talk about in detail as as we move on in the presentation. Fact or fiction? Children need less sleep as they enter adolescence. And again, does research support this or refute this? And this one is fiction. Sleep need does not change, even though this is a common myth, I think. But sleep need does not change as kids enter adolescence, and it may even increase during this transition. There's been some research showing that daytime sleepiness increases. Kids showing that they're sleepy during the day more often, even if they keep their sleep, the amount of sleep they get each night, constant as they enter adolescence. So they're actually showing more sleepiness, which would indicate they may need more sleep as they get into adolescence. Fact or fiction? Television and other electronic devices are useful tools to help adolescents fall asleep. This one is fiction. It may seem that way. We might use it. Those may be tools that sort of, as a parent, I think, maybe release some burden. But most often, these devices, especially electronic devices, especially devices with bright screens, etc., these are going to be counterproductive in attempting to fall asleep. And we'll talk about all about that stuff a little bit later as well. And the last one, fact or fiction, environmental and biological factors unique to adolescence create a natural tendency to stay up later and sleep in later than children, preteens, and adults. And this one is fact. There are a lot of cultural and environmental factors that are unique to adolescence that sort of create a shift in the tendency to stay up later and sleep in later. Those being parents less likely to set bedtimes, part-time employment increases or begins in adolescence, bedtime is being delayed to socialize, whether it be through text message or talking on the phone, things like that, or just staying overnight at friends' houses, or just hanging out later with friends. Increased academic obligations, so you might be staying up a little bit later to work on homework and things like that, particularly if you weren't able to get that done earlier in the day. Earlier school start times. Adolescents actually get picked up first in most districts, and they start their school start times earlier, despite the fact that adolescents, as we may talk about a little bit more, have this sort of natural shift and are going to probably need to sleep in later than most kids are going to need to. And that's more of a societal problem that we can touch on a little bit later. Access to electronics, like we've talked about a little bit. Large increase in caffeine intake. So those are some of the cultural, environmental things going on with adolescence. But there's also a biological shift in, that creates this sort of natural tendency to stay up later for adolescents and sleep in later. And research does this, discovers this by measuring melatonin secretion, which is related to sleep rhythms and things. And there's been some research that has offered a demonstration of a biological phase delay, essentially a biological shift inherent within kids as they enter adolescence to be inclined to stay up later and sleep in later. So this isn't just environmental factors, and it isn't just to be defiant or to annoy the parents out there, but it's also a biological tendency for adolescents to want to stay up later. And it has even been shown through some research that the end of adolescence or the end of puberty is marked by a shift back to the normal phase delay, the normal rhythm, so that they shift back to a tendency to want to fall asleep earlier and wake up earlier, and that kind of marks biologically the end of puberty. So with all that in context, why is sleep important in adolescence? Adolescence, for a number of reasons, is a crucial foundational period of development. There are things going on psychologically, the development of an identity, of a consistent ego. and things like that. There are things biologically. Obviously, we talked about the components associated with puberty. So there are things going on biologically that are also very important developmentally for a human being during this time in adolescence. What's happening here is a child, when you think about a child, they have much less autonomy, much less responsibilities, much less fears. And her sleep and wake times as that child are going to stay pretty constant throughout the week and weekends as a result. This is all going to change in adolescence. So it's it's understandable that this stuff happens and adolescents start to discover that they have a more difficult time getting adequate sleep. But just because it becomes more normal in adolescence doesn't mean that it's not an issue. And in fact, I'm going to demonstrate that it is an issue in a number of ways. Again, puberty involves significant maturational changes. And adolescents are already at risk for behavioral and emotional problems. So as parents out there, parents of adolescents, I'm sure, have realized there's already a risk there. I mean, the things that they're going to go with in terms of struggling for independence, trying to develop themselves as individuals, there's already a risk for some emotional and behavioral problems. Inadequate sleep is going to complicate those risks. So there's some significant functional impairments in adolescence associated with inadequate sleep. And when I say inadequate sleep, I don't just mean not enough. It could also mean that they have problems falling asleep or waking up, or they get enough sleep because they engage in compensatory sleep on weekends. So they're basically making up for the sleep that they lost during the week by sleeping in through the morning on weekends. So this is something that can happen as well. But so the three main associations that I want to talk about is inadequate sleep's association with problems with mood and behavior, impaired school performance, and obesity. These are three associations that have been shown in research and literature that I think are the most important as it relates to sleep in adolescence. The associations are numerous here, but these are the ones that I'm going to focus on today. So we'll start with mood and behavior. Adolescent sleep and mood and behavior. Their research has shown significant associations resulting from insomnia or hypersomnia in adolescents. Insomnia being the inability to fall asleep or stay asleep or both, and hypersomnia being excessive sleepiness, chronic sleepiness, or trouble staying awake during the day. So keep those definitions in mind because that's what we're talking about here in this instance. If both of those things are going on with an adolescent to the point of clinical insomnia or hypersomnia, mood disturbance is 12 times more likely for that adolescence. Again, we're talking about an association, a snapshot of this adolescent at one point in time. That adolescent, if they have insomnia or hypersomnia, is 12 times more likely to have a mood disturbance, meaning depression, meaning anxiety, and other emotional problems. Suicidal ideation is 9 times as likely if that kid has both of those things going on, insomnia and hypersomnia. Interpersonal problems getting along with peers, getting along with family members, and just general social communication. For physical health, the association increases with these conditions. Fatigue, which in this case is similar to hypersomnia, but it's more of a physical feeling of just feeling physically fatigued. 6 times as likely with either insomnia or hypersomnia. And then absence from school due to illness is significantly more likely to be a common occurrence for adolescents with insomnia or hypersomnia. Now, there are a couple different ways to look at these associations. We could say that the decision-making, the alertness, the brain restoration, all the stuff that comes with adequate sleep is impaired, and that's leading to these, these mood disturbances, these suicidal thoughts, things like that. The decision-making is impaired because of the sleep. There's also, though, the very realistic possibility that these mood disturbances, these suicidal thoughts, is leading our kid to have trouble staying going to sleep at night and waking up in the morning, staying awake at night, being engaged interpersonally and different things like that. So right now, at this point in time, what we're talking about with this research is just there's a strong association, strong relationship between these types of factors and poor sleep in adolescence. A little bit more on this, adolescents who receive less than adequate sleep. So now we're just talking about anything below adequate. The threshold for adequate is usually set between 8 to 9 hours of sleep and no wakes during the night, and ability to wake up, not feeling tired during the day, all that stuff. So anything below that threshold set by the researchers is going to be considered less than adequate. Adolescents who receive less than adequate sleep are significantly more likely to have increased sleep or wake problems, such as being late to class because of oversleeping, being tired or having a difficult time getting out of bed nearly every day, needing more than one reminder to wake up. Reminder, I'm sure, being from the parent. So there's the burden there that I'm sure some of you parents out there have experienced. And then they're going to be significantly more likely to have depressed mood. So this isn't even clinical insomnia or hypersomnia. This is simply less than adequate sleepers, which is going to, as we've talked about, going to comprise the majority of adolescents today. Okay, before I was talking about the associations demonstrated in the research, but there's some research, and there's quite a bit of research out there right now that's looking at sleep as a cause, as sleep as a precursor to some of the problems in functioning that kids have. So they notice impairments in sleep, and they look at two groups. Essentially, what most of these articles will do is they'll look at two groups, similar parental context, similar emotional functioning. They try to control for as much other variables as possible, but they have two sets of kids. One kid who, at a certain point, is getting enough sleep, and that's one group, and then the other group is comprised of kids who are not getting enough sleep. So that's kind of what these studies are going to look like. And what some of these studies have found, the first one here, less sleep in early adolescence, so they're looking at early adolescence kids, and that's their group. This leads to declines in self-esteem, grades, hours of sleep, and an increase in depressive symptoms years later. So basically they looked at someone at the beginning of high school, and they were looking at these groups and following them to the end of high school. And with everything else being the same as far as the researchers can control for, the adolescents that were getting less sleep early on are going to be associated with all of these problems later down the road. Another article that demonstrated that childhood sleep problems lead to greater risk for anxiety and depression as adults. So if there are sleep problems there, with everything else being the same, the kids with the sleep problems in childhood are at much greater risk for anxiety and depression in adults. So again, that's childhood, that's pre-adolescence, but what they're trying to do is say sleep, the poor sleep patterns started happening first, and then this is what happened later on. And again, just more research demonstrating this phenomenon. Childhood sleep problems lead to attention problems, aggression, anxiety, and depression by ages 12 to 15. So again, they're starting in childhood and showing that if sleep problems develop, that's going to lead to problems in adolescence. So, I guess this research really extends to, this isn't a problem for adolescents or for parents of adolescents. This sleep is something that we should be considering as important from the jump, is kind of the impression that I get after reading some of this stuff. And then the history of adolescent insomnia. So what we talked about, again, insomnia being troubles falling asleep or staying asleep. A history of that in adolescence leads to a risk for anxiety disorder, nicotine dependence, and substance abuse and dependence in adulthood. So I think that's, as it relates to sleep in adolescence, and if you're a parent of an adolescent, that's something to consider as we're sort of sculpting and creating this person so that they can grow up and be, the adult that we hope for them to be, get them to where that they're thriving in a way that would make us feel like, we did our jobs. That's something to think about, is what's happening with our adolescents, and if associations are being demonstrated here with adolescents and a lack of sleep in adolescents, and associations with significant mood disturbances and substance use and dependence disturbances in adulthood, then I think it's something to think about when we build our priority list with our adolescents. I want to shift a little bit. We talked about the associations with mood and behavior disturbance. I want to shift to the associations between sleep and school performance in adolescence. So some researchers put together as extensive of a list as they could think of in terms of the best possible predictors of school failure, so failing grades in coursework or having to retake coursework. The best predictors of those things turned out to be these two factors: parents' educational level and children's fatigue, which was defined by these researchers as difficulty to arouse in the morning and the need for daily naps. So that sort of hypersomnia presentation, that presentation of very difficult to arouse in the morning, and then wanting to take naps or feeling tired throughout the day and feeling compelled to take naps throughout the day. Of sleep habits, of all these factors that I'm about to list, sleep habits, exercise, eating, mood, stress level, social support, and religious habits, sleep habits was the strongest predictor of those of GPA, for adolescents specifically. And research shows essentially more sleep time equals higher grades. It's a pretty strong and consistent correlation. The more sleep time you get, the higher grades that you're going to have on average, of course. So if you think about this intuitively, and you know your adolescent if you have one, an adolescent is likely to pursue their immediate goal. You know what I mean? It's easier for us as adults to kind of look ahead, to kind of think about secondary gains, to push through physiological signals such as I'm tired, I need to be sleepy, or I need to rest my head, or I need to think about sleep and not what I'm supposed to be learning or what I'm supposed to be doing right now. It's easier, I think, for adults to push through. But for adolescents, as you guys know, it's likely that they're going to pursue their immediate goals. So if they're sleepy, if they're going through school each day feeling sleepy and feeling compelled to go to sleep, and they're getting signals that, I'm sleepy, I want to sleep. Because if you're an adolescent and you feel sleepy, you want to sleep. You want to respond to your feeling in that moment. If it's sleep, then it's not learning. That's I think the crux of these associations, is that if their goal is to respond to their sleepiness, then their goal is not to learn what's up there. You know what I mean? So that, I think, is why you see such strong associations between sleep and school performance. And a little bit more on this, sleep deprivation and sleepiness can impact, and this is kind of what's going on structurally, cognitively, what's going on in our minds at this during this context of sleep deprivation and sleepiness. It can impact memory performance, and it's been shown to impact memory performance, verbal fluency, which is just a rate at which you can produce words, computational speed, abstract problem solving, which is just your ability to analyze information and solve problems on a more complex thought-based level. Really have to try to think through the problem rather than just concrete question and answer. Like solving a social dilemma would be an example of that. And reaction time. Reaction time is actually shown, out of all of these sort of cognitive executive functioning factors, reaction time is shown to be the most sensitive to sleep deprivation and sleepiness. So you can imagine, how that relates to adolescent driving, adolescent athletics, and different things like that. So reaction time is obviously going to be important, and sleep deprivation and sleepiness is shown to have an immediate impact on reaction time based on studies in sleep labs and also in normal context settings. And here's that sleep and obesity link. And this research is newer. I think that this is sort of, we have such an issue, and I think, we've all been made aware of the problems with obesity in America in particular. And with adolescents, I mean, we're not showing much of improvements in this area. So we're looking at adolescents, and a good number of adolescents are obese as well. So there's always going to be research out there looking at, okay, how can we make an impact on this sort of societal issue of obesity? There's an inverse association that's been shown of either too much or too little sleep and BMI. So the BMI is going up if on average for adolescents as they get too little sleep or too much sleep. And we haven't talked a whole lot about the too much sleep, but there's certainly a cap. I mean, if they're getting 9 hours of sleep at night and then they're getting, maybe they're taking 2 or 3 hour naps in the middle of the day, there's something else going on, and that could be, up to you and your therapist, or you and your physician, or you and the rest of your family to decide what else might be going on, whether it's a mood problem or what. But there is such thing as too much sleep, so just keep that in mind. Sleep may alter both the energy intake and the expenditure processes. So sleep is going to impact, because, and I think this ties very well into the restoration processes that happen while we sleep, the physical and mental restoration processes. So it's sort of a restoring effect of the physical fatigue and mental fatigue that occurs on any given day. And also, what happens in the brain, what happens with the body. Essentially the brain is working on restoring some things while we're sleeping. And so sleep may impact how we convert food into energy, and also how we release that energy, and how we use that energy. Sleep affects decision making, of course, which can include decisions regarding diet and exercise. So just think about, we know that sleep affects decision making. Just think about, in any context, decision making is going to be important, and that's going to include decisions such as what I'm going to eat today, or what I'm going to put into my body, or if I'm going to exercise, or what type of exercise that I'm going to put in. So there's, just to give you a better understanding of kind of what's going on internally for us biologically, there's this direct competition between sleep and arousal, and it's not always a struggle. I mean, it's a natural cycle. And essentially, if you can just picture a wave, we have a high arousal state, and then we have our lowest arousal state. That lowest arousal state being, the time when it's time for us to sleep. So this is a biological wave that's occurring within us at any given time. It's a natural cycle that the brain produces. But it also, sleep versus arousal on any given moment can be sort of this tug of war. And this is just us sort of, going beyond our biological instincts and just doing, making decisions on our own. At any one moment, the arousal state is strongly influenced by mood, level of focus, what we're attending to. So if you're focusing on something, you feel like this is very important to me now, that's going to affect your arousal state. If you're being aroused emotionally, and by aroused I just mean anything, there's a number of things, whether it be an emotional conversation, an emotional movie, a video game that makes some sort of emotional connections in the brain. There's a number of things that can impact this arousal state and can lead to increased arousal. And so just imagine the process, again, as we go down into this increased arousal state. At any one moment, there may be, some environmental factor that gives us a little bit of a jump there, that slows us in our natural process and arouses us past the point where, it's no longer bedtime in our minds. So keep that tug of war in mind. as we talk about a couple of the key factors associated with this sleep and arousal competition. Electronics can be a key factor in the sleep versus arousal competition and the relationship. Watching TV, playing computer games, and listening to music, but not reading, and I wanted to point that out that the study found that reading was not associated with this, but those other things, TV, computer games, and listening to music, significantly delayed bedtime and relate significantly to higher levels of tiredness during the day for adolescents. So that was demonstrated in research. And the factors going on there, video games, watching TV or a movie, things like that, particularly video games is what this article demonstrated. It can be emotionally and cognitively arousing. It's going to disrupt that natural cycle significantly. And also that exposure to the excessive light that comes from electronics, whether it be from your cell phone or from your television set, that's going to impact what we have, and again, what is called a circadian rhythm, which is another one of those natural cycles that our brain is producing that is disrupted by exposure to light at night, especially light that comes from electronics, which is significantly related to daytime, even when it's not daytime. Playing computer games before bed can be particularly problematic, as I said, affecting sleep duration along with the sleep cycle. So they'll actually study the sleep cycles, and without getting too technical into the sleep phases and things like that, there's an alteration in the amount of deep sleep that one gets if they are consistently playing computer games right before they go to bed. Caffeine, and again, we talked about the prevalence of caffeine in adolescence. This is also a key player in the disruption of the sleep arousal system. Adolescents who drink caffeine regularly are much more likely to fall asleep in class. Seems a little bit counterintuitive, but what's mostly happening is they're staying awake later at night. So that would make sense. The association would be there. And also, if you're trying to compensate for lack of sleep with caffeine, as many of us adults know as well, then there's a crash factor that happens in which you're more sleepy than ever. Just as a little bit of an aside, because I think it's important to understand, so we just cut out caffeine altogether? Not necessarily, but there is a half-life of caffeine. For those of you not familiar with the term, it's essentially just means half of the substance of that substance, whatever it may be, in this case caffeine, is processed and has been digested through the body. And this is a point at which the substance stops making noticeable differences on the body and on the mind. A half-life for caffeine is around 6 hours for adults. It's probably more for children and adolescents just because of a lack of maturation of the body. So it's going to be more so for children and adolescents. So if there's caffeine intake within 6 hours of bedtime, that's going to cause a problem in the natural sleep and arousal system. Regular use of caffeine is associated with difficulty falling asleep and morning sleepiness. So I want you guys to, for those of you who are listening and have some questions and are wondering, okay, how is my adolescent sleeping? We talked a lot about inadequate sleep. We talked a lot about what's normal in adolescence and what's okay in adolescence, what can lead to sleep problems and what hasn't. I want to provide this exercise, and just if you want to keep your number in your head or write it on a piece of paper, whatever the case may be, start at 10, and this is sort of this race to bed, okay? Essentially saying, not necessarily racing to bed each night, but essentially we're saying if we're getting to 0 or near 0, and I'll give you ranges of what I feel is appropriate and what I feel may be cause for concern. You want to get to a point where you're close to 0 on this exercise, because that'll demonstrate that your child is
getting adequate sleep each night, is not at least being impacted by sleep. I mean, there might be other factors going on with them, as of course there is going to be with adolescents, but at least sleep is not an issue in their mood, in their school performance, and things like that. So keep the number in mind. Start with 10 and subtract 1 each time you agree or you confirm this statement in your own life. Number 1, your child does not report difficulties falling asleep, staying asleep at night, or waking up in the morning. So you're at 10 if your child doesn't ever complain or talk or report about any of those things, the teacher doesn't say any of those things, then and you feel like those things aren't going on based on what your child has demonstrated, then you can take 1 off. So again, starting at 10 and working our way down. Number 2, your child achieves at least 8 hours of sleep the majority of nights. And again, sleep not just being in bed. So if they're in bed by 10 and they wake up by 6, that's not necessarily 8 hours of sleep, because if they're in bed for an hour before they fell asleep, then they got 7 hours of sleep, not 8. So keep that in mind. 8 hours of sleep, of actual sleep, the majority of nights. You can take 1 off if you meet that criteria. Number 3, you have a set bedtime for your child, which you enforce each night. And this can be particularly important. I know that it's, I don't think anyone's going to say that it's not difficult to continue to enforce bedtimes as your child enters adolescence. But this can be a key factor. Is there a consistent parent set enforced bedtime each night? Because if the adolescents are determining the bedtime, as we've talked about, they're probably going to determine that it's later and later as time goes by. Just citing an article here related to this, adolescents whose parents set their bedtimes had less trouble on average staying awake and alert during daily activities, reported less fatigue, went to bed significantly earlier, and obtained more sleep per school night than adolescents who set their own bedtime. So it makes sense, right? I mean, if parents are enforcing a bedtime each night, then those adolescents are getting better sleep. The next one, number 4, your child engages in low arousal activities during the hour before bedtime on most nights. This includes reading a book. That can be considered a low arousal activity. And as we showed, that doesn't increase the arousal to the point where it causes sleep problems. But this does not include playing a video game or watching TV. So low arousal activity is something that's going to lower their state of arousal, lower their state of alertness, awakeness, so that they're preparing for that natural cycle of sleep. Number 5, your child does not use his or her cell phone, if they have one, in the bedroom after bedtime. So if your child does not, if they have a cell phone, if they do not take it into their bedroom when it's bedtime, you can take a point away. Your child typically does not wake up more than 1 hour later on weekend mornings compared to when they wake up on weekday mornings. So oftentimes what you'll see with kids, especially if they're having sleep problems during the week or staying up a little bit later than they need to during the week, you're forced to get up really early as an adolescent, as a high school student. You're forced to get up really early during the week, but then to make up for it, you'll sleep in until, you'll sleep in through the morning, or you'll sleep in much later in the morning on the weekend than during the week. But for your child, if your adolescent is sleeping, an hour or less later in the mornings on the weekends than they are during the week, then give yourself a point for that, or subtract a point for that. Your child does not have a television in his or her room. If they do not have a television, then you can take a point away for that. Your child does not consume caffeine within 6 hours of bedtime, which we talked about. I think you can give yourself a point for 6 hours, but I think 8 hours to give yourself that leeway, considering that half-life is probably going to be more for children and adolescents, is going to be important. So a morning cup of coffee, or a morning soda, or maybe a lunch soda, isn't going to be as detrimental. Not that it doesn't have any negative impacts, because it does, but it's not going to be as detrimental on the sleep cycle as anything 6 to 8 hours before bedtime or closer. Number 9, your child does not engage in moderate or vigorous physical activity within 3 hours of bedtime. So obviously we know about all the benefits of physical activity, and this is going to include sports as well. We know about all the benefits of physical activity, but you don't want to do it right before bedtime within 3 hours, because that's one of those things, when that sleep arousal tug of war, that's going to be something that's going to alter that process, and it's going to increase your physical arousal, make it a little bit more difficult to fall asleep, particularly for adolescents. Your child does nothing in bed but sleep. That's number 10. This is going to include even reading. Do that, whatever low arousal activity that you're having them do, at night to help them kind of ease into that, sleep state. Have them do it elsewhere other than at the bed. You want them to associate the bed, the actual bed, with nothing else but sleep. And if there's an association, if there's a confused association there, where there's reading going on, TV watching going on, games being played, cell phone being used, then that is modeling up that association that's going to throw off your sleep cycle and your sleep patterns and make it more difficult for you to fall asleep at night. So after those 10, just check your number there and ask yourself where you ended up. If you're in the 0 to 2 range, I'd say your child is likely benefiting from healthy sleep patterns. And these are rough estimates. I mean, this is no scientific scale. This is a scale that I've come up with based on my digestion of the literature. But just consider these as rough estimates and consider these suggestions potentially as just something to think about. If you're in the 0 to 2, your child is likely benefiting from healthy sleep patterns. If you're in the 3 to 6 range after this, it may be important to address the issues that got you stuck in the range, like more consistent bedtime, that sort of stimulus control that I talked about, essentially associating the bed only with sleep. These are types of things that, without assistance of any way, us as parents can make interventions, okay? Can intervene, can make changes in our sleep patterns for adolescents. If you're 7 or over, I would consider seeking some therapeutic assistance in order to address the current state of your child's sleep habits. It's just something, and like I said, consider it. If you're 7 or over, it's potentially look into, some, therapists can do a lot to kind of provide you a structural approach to making some significant improvements on a child's sleep. And especially if you've already attempted to make changes to their sleep patterns, and if you're still in this range, in the 7 or over range, then it might be time, to seek the resources that are out there. And I know this is all well and good, but I want you guys just to think to yourselves, and discuss, I guess, amongst your family, what are the biggest challenges you still face? What are the biggest questions you still have? And ask questions, whether it be by seeking out resources or otherwise. Ask questions, and because, like I said, it's all well and good, but it's a difficult struggle. You know what I mean? I understand that trying to get an adolescent to go to sleep when they don't want to, or trying to enforce a bedtime that their best friend doesn't have, or trying to take a cell phone away, or trying to take rights away just because of bedtime, not because they've done anything wrong. There are a lot of challenges that come with this, but it doesn't dismiss all of the issues that we brought up today. I don't think it doesn't mean that it's not important. It doesn't mean that it shouldn't be moved up that priority list, which I think is something to consider. That it's almost become normal, especially with today's adolescent. It's almost become normal enough that you can talk to this parent or this parent, and they're having the same issues. Well, it's just a part of adolescence. It's not a normative part of adolescence. It's not a part of adolescence that biologically our body's telling us it's okay, but it's just something that's happening more and more. And if you can make an impact on your adolescent's sleep patterns, sleep habits, and things like that, you're setting themselves up. You're putting them at a lower risk for a lot of problems that we talked about, and are setting them up for the best chance of functioning as adults. And of course, you pick your battles. Should you pick this one? I hope that when you ask yourself that question, you at least take in all the stuff that we talked about today and consider that. Should I pick this one? And because I said so is something that probably doesn't work well. I'm sure people who've tried it, I'm sure all parents have at some point. It doesn't seem to work well all the time. But there are ways to maybe alter behaviors in ways that isn't so direct, and it doesn't get the adolescent to respond with such defiance. And reward systems for something like sleep can be important, and that's something that I know here at the Murney Clinic there are Love and Logic courses that really offer insights into different ways that you can sort of relieve the burden of how you approach your adolescent, but also can alter the behaviors of that adolescent and put them kind of in the role of decision maker, and but in a way that they're making the decisions that you hope they would make. So classes like that, parenting classes like Love and Logic, can offer some insights into how to approach problems like sleep in adolescence. And other potential solutions, like you said, we talked about things that you can do on your own, like the sleep hygiene. And sleep hygiene, I'm just going to list these. I have handouts here, but I'm going to read them off. Just a couple things real quick. Have them go to bed at the same time each day. Have them get up from bed at the same time each day. And again, these are ideals, of course. Get regular exercise each day, but preferably in the morning. So exercise can lead to better sleep, but as long as it's being done in the morning or early in the afternoon, not within 3 hours of bedtime. Regular exposure to outdoor bright lights, especially in the late afternoon, but then not exposure to light as you enter into the evening. Keep the temperature in the adolescent's bedroom comfortable. Keep the bedroom quiet when sleeping. Make sure that there's no noises or distractions. Keep the bedroom dark enough to facilitate sleep. Again, it's that light and then dark. If we can align our lightness and our darkness with arousal and sleep, and align us with that biological cycle, we're in good shape. Use the bed only for sleep, like we've said. Take medications as directed. So if there's any prescriptions that they're taking, a lot of prescriptions either for physical problems, psychological problems, etc., can impact your sleep. So make sure that your kid, your adolescent, or yourself, I mean, this applies to everybody, are taking prescription medications or any medications as directed so as not to alter the sleep cycle. Use a relaxation exercise just before going to sleep. That can be a really good low arousal technique, such as muscle relaxation, some sort of guided imagery, or just sort of thinking dreamily about a vacation spot or something like that. Give yourself, and again, without getting into too much detail, because this is the type of stuff that a therapist can really help you with, or a counselor, or some sort of resource like that, or education, psycho-ed classes and things like that can offer you specifics on these techniques. Or taking a warm bath, things like that can also help. Keep your feet and hands warm, and they suggest here wear warm socks and or mittens or gloves to go to bed. This is, I think, not necessarily necessary, but the point of it is that they're comfortable. So if the house is cold, find a way to keep that temperature comfortable for your kid or for yourself. So those are the types of things, and also just parent-enforced bedtimes, as we talked about. Those are the types of things that you can do on your own to make an impact on the sleep of your adolescent, your child, or yourself. And then with assistance, there are other things that you can do. What's been shown effective for therapists to use it in therapy with adolescents particularly, but also with adults. Multidimensional CBT, that includes cognitive restructuring, just examining the thoughts and maybe altering thoughts that are impairing the adolescent's ability to fall asleep at night. Mindfulness and relaxation, we talked about some of those techniques just to calm yourself down and allow yourself to be at that low arousal state so it's easy to slip into the sleep state. And also bright light therapies, and specifically there's phototherapy and chronotherapy. Phototherapy is increasing sunlight exposure in the morning and decreasing light exposure in the evening. So essentially it goes in line with what we're talking about with sleep hygiene, just making sure that we're exposing ourselves to light when we're supposed to be up and taking light away when we're supposed to be asleep. Chronotherapy involves delaying bedtime and wake time, and again, this is something that I suggest doing with somebody who is trained and who understands, because this is, may seem like a little bit out of the box, but it actually sometimes can allow us to reset an adolescent's sleep-wake cycle. So again, chronotherapy involves delaying bedtime and wake time until the circadian rhythm is adjusted. And this is typically conducted over a 7 to 10 day period, usually in a sleep lab or some a supervised setting. But essentially, you're going against the grain, and you're having them stay up later and later, almost losing more sleep. But it's in a 7 to 10 day period, you're allowed to reset the cycle. So there's a lot of techniques out there. It's been studied well enough to feel confident that if you go to a therapist or a sleep lab or even talk to your physician about it, there are things that you can do to help your adolescent get better sleep. And if all other means of altering sleep patterns are exhausted, we've done the sleep hygiene stuff. There's nothing that's worked. I've seen a therapist. I've tried everything. At that point, and a therapist is likely to tell you this too, if their other techniques aren't working or if there's just your child needs more assistance, you can consult a doctor and discuss the possibility of pharmacological interventions like melatonin and other sedatives and things like that. Obviously, if we can help it, we avoid the medication component until there aren't other options to consider. We've tried other things that we can do that aren't creating that sort of dependence, but can make long-lasting changes without the use of medication. But if it means that your kid is just not sleeping and there's nothing else that's going on, then it's going to be more useful to look into something like that than just let the problem be. And that's it. Thank you guys very much.